So we look at another type of labor, which is known as a precipitate labor or precipitous labor. Precipitate labor, precipitous labor. Right. Of course, to precipitate something, you are bringing something into existence. Me, that's my understanding of it though. Let's just look at what it means. It refers to an unusual fast labor and delivery. It's so fast. So it's typically when the entire process from the onset of regular contractions of the birth of the baby is less than 3 hours. We'll talk about why this can happen. So unlike typical labor, which unfolds over 6 to 18 hours, precipitous labor is very rapid, less than 3 hours. Contractions begin suddenly and are very strong and close together. There is little to no gradual buildup. They are just going. There's no gradual stop. The urge to push may come quickly, often catching the birthing person off guard. Everything is just happening so fast in any type of labor. Now it's not cool like the way you guys should be feeling. It's cool, I'll just give birth to the baby fast. Complications can set in. So causes and risk factors. What will make you have a precipitous labor? First of all, if you have had it before. Secondly, if you have multiple babies, twins. It's not one person you are giving birth to, twins or more. If your baby size is small, highly efficient uterine contractions. So you have uterine contractions and they are very intact. Soft and flexible birth canal. So now you're not talking about the natural, some people are just built that way. High blood pressure, labor induction. So they have given you some drugs that will make those contractions to be so much. Use of stimulants like cocaine. So symptoms is sudden onset of intense frequent contractions. There's little or no rest between contractions. There's rapid cervical dilation. There's strong urge to push shortly after contractions have begun. There's feeling of loss of control or panic. Complications. For the mother, the pressure is too much. The cervix can tear up, the vagina can tear up, perineum can tear up. Postpartum hemorrhage, emotional trauma or anxiety due to lack of control. For the baby, birth injuries, respiratory issues, exposure to non-sterile environment if fetal is born outside a hospital. Of course, if this thing catches the baby or catches the mother outside the hospital environment, you have to give out where you are. Management is early recognition is very important. So stay close to a hospital if you are approaching the 9th month, please. Emergency delivery kits and instructions may be provided for home or car births, emotional support and counseling after that traumatic event. Just to tell the mother, this thing is normal, you understand? So that's it.